Good day and welcome to the first episode of Beware, Be Aware, a One Health podcast. We are very fortunate to have with us today the founder and president of One Health Lessons, an initiative to educate children and adults about the connection between our health and the health of the environment and animals. Let us all learn from her rich experience as a veterinarian, as a consultant to government institutions, and as resource speaker to several One Health events, which led her to publish a book entitled Art of Science Communication that talks about the policymakers, the public, and children. One Health enthusiasts, let us all welcome Dr. Deborah Thomson.
Hello, Dr. Deborah. It's so awesome to be here with you. Hello.
It's such a pleasure, Dr. Christian. It's the first episode, and I'm absolutely honored you asked me to be here and celebrate with
you. Is this your first time being invited to talk for Filipino audiences?
Yes, and I'm thrilled to be here. I have not yet been to the Philippines, but I have always wanted to.
How about in Asia? Do you have other audiences in Asia? Other parts of Asia?
Yes, and a few other places. Particularly, I've done a few meetings with students in Indonesia. What's interesting with so far the talks that I've given with them, it's been focused on environmental health, and the environmental health students have shown interest in One Health, which is exciting.
Okay. Yes. You are doing the most amazing work on One Health, and your platform, the One Health Lessons, it's a very interesting thing to tackle on because One Health is not a usual discussion, especially here in the Philippines. I believe that it is a part of our lives, but other people are not aware of. So would you give light on us on what is One Health for our audiences?
Absolutely. One Health can be explained in two different ways. It can be explained as a concept and an approach. So the One Health concept is that connection between our health and the health of the environment, animals, and plants. So it makes sense, right? Sick environment, sick people. Sick animals, sick people. We're all connected. And then the One Health approach. The One Health approach is really just teamwork. It's teamwork between people of different backgrounds, skills, and strengths and disciplines. And we come together and we prevent and solve health problems. So.
Okay, I see. It's like interconnections between physicians, veterinarians, environmental health scientists, and any part of the society, actually. So how did One Health drove you to where you are right now as a veterinarian and as an educator? Have you always seen yourself focusing on this career path, just focusing on One Health?
The thing, I laugh because this career path didn't exist until I created it.
Yes.
So, I know that sounds funny. Let me explain it a little bit more so people can have a better understanding. So before veterinary school, I was already teaching. I was teaching children as young as 5, 6 years old, and I was teaching adults as old as 65 years old. So I had that experience of understanding what works and what doesn't work for different age groups. And when I was in veterinary school, I first learned about One Health, and I thought two things. Number one, my life finally makes sense. And number two, why didn't I know about this 20 years before?
Yes, exactly. It's like we only knew it on vet school, right? We did not know it before vet school. It's like it doesn't exist before that time.
Yeah. And when I heard that term, One Health, I was like, oh my Lord, like my life changed in that moment. It was one of those light bulb moments, as we say. And ultimately, I did not get a MPH, a Master's of Public Health. Instead, what I got was something that had a good amount of overlap with the Masters of Public Health program. But concurrently with my veterinary degree, I did something, it was a postgraduate certificate in international veterinary medicine. And in retrospect, what that was is really one of the first One Health programs in the world. But you didn't call it One Health back then because it wasn't a very common thing to say or call, right? So I had that education. I had that, it wasn't only simply veterinary school, but I took all these additional classes. It was a 4-year program, and I got that certificate. But the problem is that at the time when I was graduating, this was a while ago, at the time I was graduating, unless you had an MPH, you were not going to work in the One Health space. So I scratched my head. I did not have it. I did not have the energy to go back to school and do an MPH. I did not. I knew that it would not work well for me at that time. So I go into clinical veterinary medicine, but I always have the One Health mindset. It's not just looking at the patient in front of you. It's looking at the environment that the patient lives in. It's looking at the family that's surrounding the patient. Is this an indoor only animal or indoor outdoor? And then if this animal is itchy, is there anybody in the house that's itchy? Because ringworm or a fungus can transmit between different species, for instance. So always having that One Health mindset throughout my career. And then just fast forwarding, for the last few years, I've been creating lessons for children and adults about One Health. I was doing that for fun. And onehealthlessons.com was launched on May 1st of 2020. Since then, the lessons that are on onehealthlessons.com are being translated into 88 languages today. And we need more Tagalog volunteers, actually.
Oh, that's perfect, I think. So this onehealthlessons.com. So it was just launched last 2020, right? So it's like in the middle of the pandemic, which is very timely for me, I think. This platform educates both adults and children. Yes. So how is it? What's the significance of educating children at this young age of mind in One Health? And also, what is your approach? Because it's definitely harder to teach children new things, especially One Health. What is your approach on making children understand One Health?
Wow, there is a lot. There's a lot that you just said.
Yes.
I should be writing notes to make sure I don't lose anything. Let me just make a remark about the timing of the launch of the One Health Lessons.com, the website, and then I'll talk about the methodology of bringing One Health to children, if that's okay. So the interesting thing is that we call it serendipity. In January of 2020, before it was like January 4th or 5th that I was having a conversation with a friend, and I asked this friend who knew that I had been teaching for years about One Health. I asked this friend if she can connect me with another person who I greatly admired in the One Health space. And she says, sure, I could do that, but what is your website? And at that point, it was just me going into classrooms with my friends, and there's nothing to prove.
There's no website yet.
There was nothing to prove for my actions, It was just somebody trusting my word. So I said, okay, well, the website will be done soon. And then from there, since the website has launched, I have been able to meet and speak with that woman who I greatly admire in the space. So that was great. So full circle there. But I did not necessarily launch it because of the pandemic. I launched it because of that conversation back in January of 2020, because I needed a website anyway. Okay, methodology for teaching children about One Health. For any audience, you have to engage them, especially if you're teaching online. What is holding a 6-year-old near the computer? Nothing. They can easily walk away, right?
Yeah.
And a 16-year-old might want to walk away, but they're not. Sometimes they do, or sometimes they can't. But you have to engage them. So these lessons that I have created for children, same as adults, I want the audience to laugh, to play, to have fun, to invest themselves in learning, staying around for the next portion of the lesson, because they see that there's a benefit to it, because it's fun.
Yes.
When I used to teach in a middle school, so my students at that time were between the ages of 11 and 16. And that's a difficult age. I don't know, Dr. Christian, if you remember your life when, between those ages 11 and 16, but
not so much, I think. Yes.
Oh, good for you. Yeah, I remember it, and it was tough. But the thing is, if you get somebody distracted enough in that they're having fun doing something, then they learn at the same time. And so that's the point of One Health lessons. You're not just preaching, you're not just talking, you're engaging with the student.
Yes. Because they can easily go on their attention to other else. Yes.
So easy.
Okay. So this onehealthlessons.com, which was launched just 2020, and you've been able to translate the materials in 88 language in, I think it is only about a year or so. That's an amazing feat for me. Yes.
Thank you. But keep in mind, I only speak 2 languages. I do not speak 88. This was a global effort by absolutely inspiring volunteers from around the world. And One Health Lessons has a family of interns, and right now we have a 6th class of interns. Just a heads up for your viewers, the next intern class opportunity will be, just go on our social media, of course, connect with me on LinkedIn, but it will be posted around May or so, because this current class of interns will finish in June 2022.
Okay.
So
June 2022. Okay. Heads up for everyone who wants to do an internship with One Health Lessons. So just connect with Dr. Deborah Thomson on LinkedIn. So that's an amazing opportunity, especially for One Health enthusiasts, students, and veterinary or medical professionals alike. Yeah.
Yeah, absolutely. I'm so honored to have over 1,000 people contribute to this global One Health education movement, because ultimately I created One Health Lessons, the organization, not for the English-speaking world. I created it for the world. And it takes a global village, as we say, a global village to make a substantial difference for future generations. So I really value every single volunteer.
Okay. So we just like to ask, why is One Health so important? Why does this whole interconnection of physicians, veterinarians, environmental scientists, policymakers important in solving and preventing the next pandemic or so?
Yeah. So easy answer. Let's do the simple answer. One Health when it comes to pandemics, when it comes to particularly complicated health issues in the world, global health, public health, community health, these are wicked problems. These are complex problems.
Yes.
It's not only unrealistic, but it is unfair for a single profession to be the one responsible for solving this.
Yes.
Because I certainly have strengths, and I have certainly areas for improvement. I prefer saying that instead of weaknesses. And my areas for improvement might be your strength, Dr. Christian.
Yes.
So if we combine our energies and we synergize our efforts, then us as a team could then solve these problems much faster.
Yes, because I imagine actually a future of policymakers, well knowledge in One Health, focusing on these global issues and preventing pandemic would be amazing. It's not only on the shoulders of medical professionals, it's not only the shoulders of the veterinarians in the field or in the clinics. It's actually a teamwork, which makes the load much more easier. And it's amazing that this concept brings the world together, I think.
Can I mention one thing? I 100% agree with what you just said.
Yes.
But there's a portion, and I'm really curious to hear your point of view, because we're on complete opposite sides of this planet.
Yes,
so
yes.
I'm really curious to hear your point of view. But when it comes to One Health advocates, and I've done research based on schools from around the world, veterinary schools, and then also associated with other programs of One Health programs. And what I realized is that they all value communication, because it's that communication piece that you need to then translate between, say, if you are Dr. Christian, let's pretend you are an environmental health scientist, okay?
Yeah.
And I'm coming from the veterinary space, but I'm a One Health advocate. So I need to not only know my language, but I need to know your language fluently, your professional language fluently, so that way I can be that bridge, right?
Yes.
And that's where I see One Health advocates really flourishing with clear communication skills, and excellent, I don't know if I like the word networkers. I'm going to say relationship builders, because if you build a relationship, it means that you trust the other person. And if you trust the other person, your team as a whole is going to be that much stronger. So when it comes to the interns with One Health lessons, I do teach them leadership skills, networking skills, or relationship building skills, and communication skills, because I think that would serve them well in their career, regardless of what they do, as in their particular profession. If they want to become One Health advocates in any capacity, they need to know how to speak across those silos.
Yes.
Thank you for letting me say my piece there. So, Dr. Christian, are you a clinician now? Are you practicing? Okay.
Yes, I am a practicing small animal veterinarian.
Wonderful. So you know, just like I know from experience, that speaking with other veterinary students or other veterinarians is totally different than speaking with clients or pet owners. Totally different. So
yes,
like you live and you learn, you know what I mean? You learn from your mistakes. Or you can, at this point in veterinary school, start to practice speaking with people outside of your veterinary bubble and try to see who understands what and how do they miss certain things, and how can you adjust your message to improve the understanding of the other person.
Yes, it's actually not about medical proficiency takes part, but communication skills also play a big part in our career and also in One Health, in promoting health of everyone. That's amazing, because your internship would create opportunities for veterinary students or other students as well to develop their communication skills. So yeah, for our audiences who wants to do an internship, you could sign up for the 2022, right? 2022. Okay. I think there's,
Oh, pardon me.
yes. Let me just ask, for what do you think is the future of One Health? Yes, from where we are currently standing right now. What do you see is the future for One Health and for One Health professionals and advocates as well?
As long as the people who value One Health now can communicate the importance of One Health to not only the general public, but influencers. So that includes policymakers, that includes social media influencers, that includes celebrities, you know, people of any type of influence is what I'm talking about.
Yes.
Then I have a lot more hope for the future. Our trajectory across the world looks like more people are starting to appreciate not only that connection between everything, but also the importance of having that type of teamwork. Now, I can't necessarily speak to at the government level in the Philippines, but I can say in the United States, there's starting to be some efforts at the policy level, as well as in Bangladesh. If you're not aware, your audience is not aware, there's something called One Health Bangladesh, and that's worth looking into. It's a fascinating story. And they even have a One Health Secretariat at their national level, which is outstanding. But here's the thing. It goes back to that communication piece, right? So when we want to change the future, we have, and you want to make it as simple as possible with this discussion, we have two options, okay? And our energy is not unlimited, right? We have to be strategic with how we inspire others, right? They're not more than 24 hours in a day.
Yes.
We can work at the top down, which is speaking with the influencers and having them then sharing knowledge with everybody else. The other thing that I think is equally as important is to make sure that not only the general public understands the importance of One Health, but children. And so I actually wrote a book, The Art of Science Communication, that goes over, that reviews that if you are going to speak with a politician, excuse me, if you are going to be speaking with a policymaker, and I know this firsthand because I worked in the federal government already in my career as a science policy advisor, but if you approach a politician, a policymaker with an idea, you need to make sure you communicate that crystal clear with them. And it's not just about providing the problems that you have identified in your community or your country or, you know, the world, but you have to provide them with solutions, and they have to be feasible solutions. So what I mean by feasible is this solution capable of being achieved in, 2 years, or is it 5 years, or is it 10 years? How much money does it cost?
Yes.
Health advocates need to understand the conversation behind money, because that is what policymakers always think about when it comes to legislation. And the best way to practice and improve your science communication skills as a whole is to teach children. And we also, besides the internship, we also have a lesson leaders program that I don't know if you're aware of, Dr. Christian. If you want, I can
Lesson leaders program.
Yeah, so if you go to onehealthlessons.com, and there's an area that says get involved, and you'll find more information there. But quickly, what the Lesson Leaders program is for volunteers around the world the requirement is you have to be at least 18 years old.
Okay.
We do randomized background checks to make sure that there's no trouble getting into classrooms, or any of that. But we have this Train the Trainer program called Lesson Leaders Program. It is of 4 hours for training. It's not 4 hours straight. It's 1 hour,
Okay.
1 hour, then 1. And then after those 4 hours, at the end of that, you will have already understood how to communicate with a 6-year-old versus a 16-year-old versus a 36-year-old. You will understand different teaching techniques and communication techniques. You will have observed a lesson be taught, likely online. And number 4, you would have already taught a live lesson, either in person or on the computer. At that point, you become a certified lesson leader. But for the extra special people out there, there's something called a One Health Lessons Ambassadors program. Should I go into that?
That's other else, right? From the lesson.
That's more advanced. Yeah.
Yes.
That's more advanced.
What's the difference between the two?
Yeah, so it's 4 hours of training to become a certified lesson leader. And then for the extra special people, the people who are doing this not only to improve their own science communication skills and, to put this on their resume, but the people who really want to make a difference in their community, the people who really, really, really want to
have an impact. Yes.
Yeah, to have a legitimate, real impact, and this is for the people who are doing this, for the right reasons, outside of themselves. You know what I mean?
Yes.
So what you do if you want to become a One Health Lessons ambassador is that you become a certified lesson leader, and then you teach at least 5 times in your own community, in your own first language. And we at One Health Lessons, we get documentation, we get proof, because the full-time teacher in the classroom where you are visiting as a science role model, they have to just fill in a quick questionnaire. And if you finish those 5 hours, because each lesson is an hour, if you finish those 5 hours and teach 5 different classrooms, then you are recognized in a graduation ceremony for a One Health Lessons Ambassadors graduation. Actually, our next graduation ceremony is on November 6th of 2021. And we have 13 graduates expected to be there. Our first class was just 5. So we're growing.
Oh, so these graduates are from around the world, right?
Around the world. And the beautiful thing is they come from all different backgrounds.
Oh, not just veterinary students, not just medical professionals. That's amazing. Yeah. You really reach out to people. Like, did you expect this? Did you expect that there's going to be global outreach? You would be able to reach people of different races, different ages, different backgrounds. Have you foreseen this when you started One Health Lessons?
When I started teaching children about One Health, I made a specific effort to go to underserved communities in the United States, places where there were not very strong science programs, places where the kids really needed to see a scientist, and I consider veterinary scientists.
Yes.
Applied scientists, but then again, they're veterinarians doing research, of course. But to see scientists come into your classroom as a child, you, number 1, feel special. Number 2, you see that this scientist looks just like you and me, like a regular person. They're not wearing a cape. They're not wearing a white coat. There's no. They look like a normal person, is what I'm getting at. And so it makes science be that much more relatable. And if a child sees, oh, well, a regular looking person can do this, maybe I can do this. And even if they don't go into science, say they want to go into literature or any other things, it's fine because they already understand the importance of One Health because they're learning that at a young age. Think about this. If you educate a child and they're 6 years old and they learn about One Health, that 6-year-old can, I call them like stem cells. They can develop into anything. They can develop into a politician. And can you imagine how policy and laws can change if people grow up with this innate knowledge and respect of One Health? And that's the purpose of One Health lessons is it's really to change society and societies around the world. But to answer your question, did I ever imagine this? No. I just put up the website because I needed to try to connect with this woman.
And now it led you to something greater than what you expected. You made, I think for me, you made science relatable. You made science relatable. Yes.
Very high compliment. Thank you so much for that.
Yes. I think you also shared a little bit about your book, The Art of Science Communication. Yeah, it's actually basically making science relatable to other people through effective communication. So when did you start doing this book? I think you have a lot of time on your hands, and you also wrote a book. I think I would like to grab one copy of mine someday.
Oh, cool. It's available on Amazon if Amazon is available. Also on my website, it's Deborah, 𝗕𝗓 and then hyphen Thomson, 𝗕𝗓𝗏𝗡𝑚𝑠𝑜𝑛.com. Information for that book is there. But when it comes to this book, I divided it into 3 sections. How to share knowledge with students, how to share knowledge with the public, and how to share knowledge with policymakers. Because I have been a teacher for a while. I have been teaching for a while. I'll say it like that. I have been a public speaker for years, so communicating with the public, and then I was working with the federal government with policy. So I have lived those chapters already. And what I realized, and I encourage this for anybody, after you finish a project, write down in a notebook lessons learned. Because what I did was, especially after the policy position, I was writing down notes. And I was looking at these and I'm like, I can't, it would be selfish of me to keep this only in my notebook. I need to share this with the world to save time for others. And it's a very short book. It's 92 pages. And I did that on purpose because I want it to fit into a pocketbook, like a purse. I want it to fit into a backpack. I want it to be accessible to as many people as possible. So yeah, that's what the book's about. So the art of science communication.
This would actually equip scientists to endorse their projects or ideas to policy owners, policymakers. Would make the change even faster with effective communication, right? So that's amazing.
Thank you. I was just going to say there's been communication specialists coming from the OIE, it's like the World Health Organization for animals, and other international groups that have been working in policy or working with policymakers for years, and they're approaching me online on LinkedIn and they're saying, I wish I knew about this at the start of my career. So I'm really grateful I finished it, because writing a book is it's a project. It's not easy project.
Thank you, Dr. Deborah. Your insights and your expertise really inspired us and also inspired the audiences, I hope, on focusing on and going on the path of One Health, I think, changing the world, making science relatable, veterinary medicine relatable, medicine in general relatable. Also, I would like to ask, how would we be able to One Health enthusiasts or students would be able to reach you for future collaborations or so?
Oh, thanks for that, Dr. Christian. So we are on a lot of different social media. Wow. Okay. So One Health Lessons is on LinkedIn. We have a YouTube channel. YouTube. You have YouTube in Philippines, yeah?
Yes, yes.
Okay. You have Instagram there?
Yes.
Yeah. Okay. I don't know. There are certain countries that don't allow.
Yes, there are.
We are on Facebook, Instagram, YouTube, LinkedIn, Twitter, and we're starting with TikTok, but I'm not sure if we're gonna. I don't know if TikTok is enough in the Philippines, but yeah, we are on several different social media arenas, and I do encourage everybody to reach out to me, connect with me on LinkedIn. Deborah Thomson, and it's on LinkedIn it's Deborah Thomson, _DVM. But yeah, and go to onehealthlessons.com and check out the Get Involved area, and hope to have you all join us and contribute to the global One Health education movement.
Yes. Okay. To end our event, would I just like to ask one last question? What do you think the role is for the common people, for the public, to be on this One Health journey? What is their role beyond veterinarians, physicians, policymakers? What is the role of that young man, that young girl on One Health? What can we do to improve One Health in the society?
We have 3 things that I can think of immediately. Number 1, share with others what you learned today. If this is the very first time you ever heard of One Health, share that knowledge, because the more people who are simply aware of how we treat the environment can play a role back in our own health and our parents' health and our children's health and our brother and sister's health. That means a lot to people. Make sure it's relatable to that person that you're speaking with. So that's one thing. The other thing is, if you see litter, on the street, bring something to help pick it up, because ultimately, and do it carefully. I don't want anybody to get hurt, of course, but if we have a stimulus in our environment that attracts wildlife to get closer to us, then that's number 1, not ideal for the wild animal, because we can make them sick and they can possibly make us sick, right? So it's respecting that distance, that natural distance between us and wildlife. We can, of course, plant more trees, but think of it like this. If you want to start to have an influence on changing long-term laws and policy, as an individual, as a public, improve your communication skills. And once you feel comfortable being able to speak with children, who are a very honest audience, they tell you when they don't understand, and you feel comfortable at that level of speaking with them about One Health, that's the time you go to a policymaker or another influencer and share your knowledge with them.
Thank you, Dr. Deborah, for your time. Thank you, everyone who are hearing this now. Thank you so much for spending your time with us and sharing your expertise. We just like to say that we have learned so much and we have been inspired. Thank you.
This first episode of Beware, Be Aware, a One Health podcast is brought to you by the Veterinary Circle for 10 and One Health Lessons. and co-presented by the One Health Commission, International Student One Health Alliance, Cavite State University's 𝗕𝗘𝗪𝗔𝗥𝗏 Society, and Veterinary Student Government.